Hi, I'm Drudis Ledbetter. I am a nurse, a clinical system strategist, and the founder of Mac Burnett Consulting. I'm also a medical cannabis patient. I founded Cannabis in Healthcare as a media platform to ensure that everyone's cannabis story was heard. And I want to tell you my cannabis story first. My cannabis story starts the same way a lot of people in healthcare's cannabis story starts. We become patients and we see patients. Throughout my nursing career, I kept meeting patients that were already using cannabis to manage sleep, nausea, anxiety, and symptoms around quality of life. And they were using it like before surgery, during treatment, as part of their every single day. And I, as a clinician, also carried a bias, a stigma. I had an idea that this medicine wasn't useful, as many of us did, until I became a patient myself. About 12 years ago, after the birth of my second child, I suffered from deep postpartum depression. And during that struggle, insomnia was my biggest symptom. And about 6 months later, after trying therapeutic medication that was prescribed by my psychologist, I was giving up. Nothing was working. So I was introduced to cannabis. And I always tell this story because I feel like cannabis saved my life. And one of the things that happened once I became a patient is I had to start living the life of hiding my cannabis consumption, my cannabis advocacy, and all the education that I wanted to share about the plant with other clinicians and other patients. And I knew that me sharing my story was important because I'm a nurse and people trust us. They know that we've done our research, they know that we've looked ahead, they know that we've checked some things. But everything wasn't available 12 years ago. And there's so much more available now. Alongside prescription medications, most cannabis patients are also taking medical cannabis. They're doing it every single day. And then they walk into healthcare and they don't really talk about it. And if they talk about it, it's not being documented consistently. It's not part of our clinical workflow. It's not something that we know how to store, we know how to educate, and we know how to integrate into our healthcare system in a meaningful way. And that leaves patients to navigate this alone, disconnected, self directed, trying to figure out how to onboard, how to dose, and how to use the plant. And honestly, healthcare needs to do better. So I created this channel because these conversations belong in healthcare. This is going to be the channel where we talk honestly about what clinicians are seeing, what patients are experiencing, and what systems are missing because we need something. We need infrastructure, we need policymakers, we need patient voices, we need researchers, we need frontline clinicians, and most importantly, we need nurses to step it up. We are the only profession that has made this a specialty. So we need to make sure that we're able to educate and support our patients when they walk through our doors. We don't have a lot of time. Medical cannabis is a Schedule 3 medication today. If your patient is part of your state's medical program, they are a Schedule 3 medication holder today. So we need to start thinking about how we deal with this in healthcare today. Let's start the conversation, and I hope you'll join us and stay with us and hear from our experts. Subscribe, join, follow, share. We all need this, and I hope you'll join us on this journey. Thank you very much.